Hey everyone, Jonathan Bailor back. Very, very exciting show today. We have a guest with us who is literally a pioneer in the field of mind-body medicine. She conducts ongoing groundbreaking research which focuses on the relationship between stress and various medical conditions, as well as the impact of lifestyle habits on mental and physical health. So we're just talking home runs. She has a master's and a PhD, and she is currently the executive director of the Domar Center for Mind-Body Health and the director of Mind-Body Services at Boston IVF. She's also an associate professor at Harvard Medical School and a senior staff psychologist at Beth Israel Deaconess Medical Center. Dr. Alice Domar, welcome to the show.
Thank you so much, Jonathan.
Well, Ali, you have done so much. I only got through a little bit of your bio. Can we back up and start with little Ali and how you got on this path to do that which you're doing today?
Well, it's funny because when you're on the path, you don't really think about where you're heading. I mean, I was one of those kids who was always interested in medicine. And I went to college thinking I wanted to be a physician. And after college, I started thinking, I don't really care so much what's wrong with people. I care how they react to it. And so I decided to take 2 years off and worked for a psychologist and a neurologist and decided that, I would just sort of go into whichever job I liked better. And I realized we were doing brain research. And I realized quickly that I would be looking at these computerized EEGs of brain activity. And I realized I didn't really care so much what was wrong with the person. The diagnosis wasn't interesting to me. What was interesting to me was how people reacted to it. And so I decided to go into health psychology. And so I got a PhD in health psychology. And that was, perfect fit. It was the first time in my life I found school easy, because it was the first time I was studying what I really wanted to do.
Health psychology. Those are two words that sometimes we don't hear put together. What is health psychology?
Well, in those days, it was a very, very new field. In fact, in the PhD program that I went to in New York at Albert Einstein College of Medicine, I was only the third year that the program was open. And the idea was that so much of physical illness involves psychology. And, when we think of mental health issues, we think of people who have, schizophrenia or bipolar illness or depression or anxiety. And again, those things honestly didn't interest me. I had no interest in clinical psychology, but I'm fascinated by medical conditions which cause people to have to adapt. And I'm also fascinated about what psychological factors can cause physical symptoms. So health psychology looks at the interaction between the mind and the body. And so the program that I went to at Einstein actually has three main components. You have to learn medicine, you have to learn research methodology, and you have to learn to be a therapist. In health psychology, they primarily focus on cognitive behavior therapy. And the goal of the program is to train psychologists who can work in a medical setting and speak medicine with physicians, which is why 2 years of our classes were with medical students, because physicians tend to speak at a very high level. They tend to be somewhat intolerant of other healthcare professionals who don't understand what they're talking about. And so the idea is to train psychologists who can actually speak intelligently with physicians. And I was very interested in obstetrics and gynecology. And so I was actually the first student in my program to major in OBGYN. The requirement of the program was that you had to have a medical major, so that, if you majored, for example, in cardiology, you would be required to know as much medicine and as much cardiology as an orthopedist. And so I was required to learn as much obstetrics and gynecology as, a pathologist would need to know. So I literally took the medical student rotation. I scrubbed in on surgeries. I helped deliver babies. That was part of my training. So when I got out, the idea was that I could be able to have intelligent conversations with OBGYNs.
And what have you found to be the most, let's say, shocking in your career relationships between the mind and obstetric and gynecological health?
Well, it's interesting because I've done research on infertility and menopause and PMS and breast cancer and ovarian cancer. So I feel like I've seen a lot of conditions in terms of the mind-body connection. And I have to say, I think the most startling results have been in infertility. And I don't know if I say that because it's so cool to help make a baby, or if it's just that's most of my research has been spent on the mind-body connection with infertility.
And what is the connection there?
Well, the connection is it's a chicken and egg question, of course, between stress and infertility. We know that infertility patients or women with infertility have an extraordinary amount of distress. They're very anxious. They're very depressed. You should be, because having a baby is a very natural thing for people who want that. And so what I've seen over the last 25 years of my career is people are, first of all, recognizing how distressing infertility is, which I think was not really, people just sort of thought women were being crazy, and they're not crazy. These are mentally healthy women who are dealing with an extraordinarily stressful crisis. And so I've documented in some of my research how depressed infertility patients are, which I think is important for people to understand. I published a paper showing that women with infertility were just as depressed and anxious as were women with cancer, AIDS, or heart disease. So infertility is a massive, massive hit. And then we've also shown, I think more excitedly, that mind-body programs can actually not only lead to a lot less distress and actually get women to be in the normal range in terms of anxiety and depression, and we can reduce physical symptoms of stress like insomnia and abdominal pain. But we also have shown through 2 large randomized controlled trials that women who go through this mind-body program are much more likely to get pregnant. And that's what I mean when I say it's really fun to help people make babies.
I'm sure you're not the only person who may have made that statement at some point in time in their life.
Yeah, but I'm a girl.
Well, Allie, you mentioned that individuals who are struggling with infertility can be as hit by it emotionally as individuals struggling with cancer, AIDS, or heart disease. And it's my impression, please correct me if I'm wrong, that the rates of infertility are going up at quite a rapid clip. What are some of the reasons for this, and can we avoid it?
2 really, really good questions. The rates do seem to be going up. I mean, it's sort of like breast cancer. They always say it's like 1 in 8. And I think right now the rates have probably gone up. An article came out. In fact, I have it here. Hold on. I can tell you the exact data. I was smart enough to keep it. Yeah. An article just came out about a month ago that say if you follow the traditional one-year definition of infertility, women in this country, 15.5% have infertility. So, it's a minority. I understand 15.5% is a minority, but it's still an awful lot of people. And probably one of the number one reasons for the increase is that people are waiting longer to have babies. It used to be, I think the average age of first conception in this country was 21. I think now it's 25. The rate of women trying to get pregnant in their 30s and even 40s has skyrocketed. And unfortunately for both men and women, aging is not your friend when it comes to fertility.
Mm-hmm. And Allie, have you found, I know there's been some pretty cutting edge genetic research in terms of actually quantifying age. And this has to do with like looking at genes and the telomeres on the ends of genes and like what is actually aging. And the reason I asked that question is it possible for someone who is, let's say in their 30s, who gets sufficient sleep, eats a very nutritious diet, is physically active, like is healthy in any sense of the word, every sense of the word, to be younger from a fertility perspective than someone who maybe practices very unhealthy lifestyle behaviors? Or when we talk about fertility, is it really chronological age?
I have to say yes and no to your question, because I think one of the hardest things to explain to patients is I think a lot of people feel if they take really good care of themselves and they do get a lot of sleep and they eat really good food and they exercise, that they don't smoke, they don't drink a lot of alcohol, and they maintain a normal weight, and those people tend to look younger than you'd expect. The expectation is because they're so healthy and they have such great lifestyle habits and they look younger than their age, that would then translate into being fertile later. And I'd say that's not the case. I mean, our ovaries don't really know what we look like. They just don't tend to know, the birthdays are passing. And so I've had patients at the age of 45 who look 30. I mean, they're gorgeous. Their skin is beautiful. They have beautiful bodies. And yet they're going to be fertile like a 45-year-old, not like a 30-year-old, despite how they look. So, it's tough to outsmart age. So that's the no question, or the yes, I don't remember which way you asked it. But on the other hand, we do know that there are many lifestyle habits which are bad for fertility. And so, the one on smoking that I think is just the most dramatic, a 25-year-old smoker is as fertile as a 35-year-old non-smoker. Mm. So in effect, smoking adds 10 years to your reproductive age, which in this world is bad. So go ahead. I'm sorry.
I was going to say, why? That's amazing. And I'm curious, do we know why? Is it something unique about cigarettes, or is it that cigarettes do something which stress the body in a way where we could say, oh, wow, these other things also stress the body in that way? Or is it something unique to cigarettes?
Well, they've literally found nicotine in the fluid where eggs grow. Mm. And nicotine is toxic. They also know that women who smoke go into menopause earlier than women who don't smoke. So clearly it has, sort of acute effects that it's in that fluid, and it also must have systemic effects to just make the body age faster, certainly make the ovaries age faster, or maybe deplete the ovaries more quickly. I think smoking is the most dramatic example in terms of the impact of lifestyle factors. And so, if there are a lot of infertility clinics in the country who won't even accept patients who smoke because they know that their odds are so much lower. Now, if you have a smoker and she stops smoking, within a few months, her odds of getting pregnant do increase. So the results of smoking are not all permanent.
And why is it so? Smoking, obviously not helpful. Seems like there's quite a bit of research saying that carrying around excess body fat is also not helpful from a fertility perspective. And if that is correct, why is it that carrying around excess body fat has a negative impact on fertility?
Well, they found for both men and women that being obese is associated with lower fertility. Not just, spontaneous conception, which is what we call couples who actually have sex, but even in couples who go for the highest tech treatment, which is in vitro fertilization. If either member of the couple, and obviously if both members of the couple are obese, even with the best medications and the best forms of treatment, their chances of getting pregnant are lower than women who are normal weight.
And do we know why that is? Is what is going on in that in the body of someone who is overweight or obese that causes the fertility to drop?
Well, we know that obesity affects ovulation. It can also affect sperm production. If obese women lose weight, their fertility tends to normalize. And in fact, a small study was just presented in California a few months ago where they looked at women who were obese. And they found that the women who lost about 10% of their body weight had an 88% pregnancy rate. Mm. Versus the women who only lost a few pounds, I think had a 26% pregnancy rate. So, there's no question that being obese. I mean, most of the research actually looks at women and men whose BMI is above 35. So I'm not really worried about women who are, 20 pounds, 30 pounds overweight. We're talking about people whose BMI is above 35. I mean, maybe most of the medications that are used with treatment are injections. And if you're injecting somebody who's normal weight, the medication tends to go into muscle. Versus if you're injecting somebody who's obese, the injection goes into fat. And fat probably processes the medication differently. But I went to an all-day symposium last year on sort of how to counsel patients who are obese. And the physician running that one section said, if a woman is 38 or above and obese, she should go straight to high-tech infertility treatment. That gives her best chance of getting pregnant. But if she's under 38, it makes sense for her to try to lose some weight and then see what happens.
And we've been focusing so far on the impact of carrying excess and lots of We're not talking, you don't look like someone on the cover of a magazine. We're talking someone who has morbid obesity. And so we talked about the impact of getting the baby to get started. What is the impact? Because I know there's some research on birth weight and things like that. Once 9 months have passed and the baby is done. Have you seen research there?
Yeah, in fact, it's funny because we started a weight loss program here at Boston IVF a couple of years ago, and we were told by all these focus groups and marketing that you don't scare people by saying if you're obese, you have less of a chance of getting pregnant, you have an increased risk of miscarriage, you have an increased risk of birth defects, you have an increased risk of premature birth. They said, no, turn it around. So our marketing materials for our weight loss program says if your BMI is below 35, you got an increased chance of getting pregnant, a decreased risk of miscarriage, a decreased risk of premature birth, and a decreased risk of birth defects. Mm-hmm. So, scaring people per se doesn't seem to work. People need to be encouraged and supported. I mean, I saw a patient last week who was obese, and it's a really hard conversation to have because she's under 38. And so, in fact, it really does make sense for her to try to lose some weight. And when I said this new study came out showing that women who lost 10% had these amazing pregnancy rates, I could just sort of see in her mind, oh my God, how am I going to lose 30 pounds? That's a lot of weight to lose. Mm-hmm. And that feels really frustrating on top of the devastation of going through infertility. But that's the fact. Now, can I just add one thing?
Please.
We focus so much on morbid obesity, but very similar data exists for women who are very thin. So there's fertility. I mean, how many fertility statues have you seen look like Twiggy? Mm-hmm. And most fertility statues worldwide show, these fertility models they have breasts and they have curves and they have hips. And so being very thin, even with treatment, can also decrease your chances of getting pregnant.
Excellent, Allie. Excellent. And I love your tagline, for lack of better terms, for your Domar Center for Mind, Body Health, and that's grounded in science, inspired by compassion, and to the point we were just talking to about maintaining a healthy body composition, which it sounds like that's the sweet spot we're after. It's like Goldilocks, not too hot, not too cold, just right in the middle. That grounded in science, inspired by compassion. It seems, I'm curious with your research on the mind relating to the body, that if our goal in terms of body composition is motivated by, say, a number on the scale, that's not very inspirational. Whereas if it were inspired and guided by creating life as resiliently and robustly and healthfully as we could, man, that's a great reason to eat more greens.
Absolutely. It's just, I think a lot of people, after trying to get pregnant for a while, the last thing in the world they want to hear is, we need you to lose weight. I mean, no one likes to hear that from anybody, but when you're emotionally and often physically depleted by a medical crisis, figuring out how to lose weight takes a lot of energy and time and attention and a readiness for change. And a lot of these couples are depleted. And so you're basically taking somebody whose cup is empty and saying, keep on pouring. And that's really hard.
And what do you do there, Allie? Because on some level, if an individual is really, really struggling with their weight, on some level, they know what needs to happen. Like they may be engaging in certain behaviors that they know on some level they should not be engaging in. But at that point, it's an emotional. There's an emotional thing happening there. So how do we as individuals overcome those emotional hurdles?
Well, what we do here, because we're shrinks, is we focus on health. And so I'll say to a patient, we're not going to focus on weight. We're not going to focus on fat. We're not going to focus on size. We're going to focus on your health. And as opposed to thinking, oh my God, I have to lose 30 pounds, let's make the goal. Let's reframe it to say, how can I live my life more healthfully? Mm. And we have a nutritionist here, and she's one of these really realistic people who eats chocolate cake. And she'll talk about how to live a healthy life. And when you think of it in terms of health, when you think of it in terms of creating a place where a baby will want to grow, it makes it a little easier.
And when we go back to speaking of making it a hospitable place, making your body a hospitable place for life as well as enjoying your own life, we go back to the studies around nicotine and actually finding nicotine there in the blood and proximate to the eggs. What is your take on so there is eating food, like even chocolate cake. Like chocolate cake you make at home using real flour, real eggs, real food, quote unquote, versus a Hostess cupcake, which is made with all kinds of stuff that you would never make. These chemicals, these edible products, which now make over 40% of most Americans' caloric intake. Do you think there's a chance that those could be doing, the chemicals in those foods could be doing something like nicotine, or is it really more just about calories and fat and sugar?
I don't think anyone's looked at it. I have no idea. I mean, certainly the research looks at BMI. There's very little research on diet per se in terms of what people eat. I mean, what makes me crazy is when my patients come in and say, oh, yeah, I saw this alternative medicine practitioner who told me to avoid eggplant, or who told me to only eat blue food, or to avoid pineapple. I mean, the fact is there's very little research on specific foods per se. What I tell my patients is to eat good food. Eat what your grandmother would have told you to eat, which means fruits and vegetables and whole grains and, lean meats. And yeah, you can have chocolate. I mean, what we teach our patients in our programs is what's called the 80-20 plan, which means if 80% of what you eat is the good stuff, the other 20% can be what you want. And the reason for that is a relatively well-researched phenomenon where, there's not a woman in this country who does not know what she should be eating. And there's certainly not an infertility patient in this country who doesn't know truly what she should be eating. And so if you've had your Greek yogurt and fruit for breakfast, and you've had a salad with grilled chicken for lunch, and then you eat a donut at a meeting, you will then experience what's called the what the hell effect. And you will then eat fettuccine Alfredo for dinner, topped off with a pint of Haagen-Dazs. And so what we teach our patients is, if you've done your 80%, you can have a couple of cookies, because then you won't have the what the hell effect. And I'd far rather see one of my patients eat a couple of cookies a day rather than eat nothing sweet for 4 days and then eat a whole box.
And it seems like that is right in line with if our goal is to avoid disease, like to do what seems natural to humans. Like to humans, it seems natural to not become sick prematurely, to not die prematurely, and to be able to create life if you happen to be a female human. So the way you would eat, if your goals are to do that, seems much more tractable and, let's say, less aggressive than if your goals were to have six-pack abs, which actually may be counterproductive to some of those goals.
Yeah, in fact, very vigorous exercise may also reduce fertility. I mean, I think the body knows what it's doing, in that the people who are most fertile are sort of mid-weight range. They eat good food and they exercise moderately. The body, the ancient part of our brain, so the lizard part of our brain, is the part that controls reproduction. And that part is very conscious of, are we getting enough food? Are we getting enough rest? Are we in any danger? Because if any of those bad conditions exist, not a good time to get pregnant. And so the body really wants things to be good before it will allow conception to occur.
Well, Ali, what's next for you in the Domar Center?
Well, I sort of tripped over a whole new area of study about a year ago. I was made aware of the risks for infertility patients and pregnant women of taking antidepressant medication while they're trying to get pregnant and while they're pregnant. And so I published a review article with a high-risk obstetrician in January, basically pointing out the risks of taking SSRIs during pregnancy. And so I become very interested in how to help women who are trying to get pregnant or who are pregnant, who have a history of depression, looking at other ways to treat their depression other than medication.
Well, certainly very, very exciting and noble, and supporting your mission of being grounded in science and inspired by compassion. Folks, our guest today is obviously a wonderful doctor, Dr. Alice Domar, doing some wonderful work. You can learn more about her and her center at domarcenter.com. That's DOMARCENTER.com. Allie, thank you so much for joining us today.
Thank you so much, Jonathan.
Listeners, I hope you enjoyed today's show as much as I did. And please remember, this week and every week after, eat smarter, exercise smarter, and live better. Chat with you soon.